Zegerid is a combination of omeprazole and sodium bicarbonate. It is used to treat stomach and esophagus problems such as acid reflux and ulcers. It can also prevent stomach bleeding in very ill patients. Omeprazole works by reducing the amount of acid in your stomach, while sodium bicarbonate is an antacid that helps omeprazole work better. This medication can relieve symptoms like heartburn, difficulty swallowing, and cough. It also helps heal acid damage to the stomach and esophagus, prevents ulcers, and may even help prevent cancer of the esophagus. If you are self-treating with Zegerid, over-the-counter products are used to treat frequent heartburn. It may take 1 to 4 days for the full effect, so it does not relieve heartburn right away. It's important to carefully read the package instructions to make sure the product is right for you and check the ingredients on the label, as the manufacturer may have changed them. Also, products with similar brand names may contain different ingredients meant for different purposes, so it's important to take the right product to avoid harm. To optimize the benefits of Zegerid, it is important to take the correct dosage and to take it at the optimal time. Before taking Zegerid, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth on an empty stomach, usually once daily. If you are self-treating, make sure to follow all directions on the product package. The dosage and length of treatment are based on your medical condition and response to treatment. In children, the dosage is also based on weight. Do not increase your dose or take this drug more often than directed. If you are taking the capsule, swallow it whole with a full glass of water. If you are using the powder packet, empty the contents into a small cup with 1 to 2 tablespoons of water, stir well and drink the entire mixture right away. If you are using the suspension, shake the bottle well before each dose and carefully measure the dose using a special measuring device/spoon. Do not substitute the capsules, the powder packets, or the suspension for each other, unless approved by your doctor. Use this medication regularly at the same time each day to get the most benefit from it. If you are self-treating, do not take it for more than 14 days unless directed by your doctor. If your condition lasts or gets worse, make sure to tell your doctor. If you think you may have a serious medical problem, get medical help right away. Common side effects of Zegerid include headache or abdominal pain. If these effects persist or worsen, notify your doctor or pharmacist. Remember that your doctor has determined that the benefit of using Zegerid outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it is important to inform your doctor immediately if you experience swelling of the hands or feet, signs of low magnesium blood level, sudden weight gain, signs of lupus, dizziness, muscle aches or spasms, mental or mood changes, vomiting, weakness, or symptoms of a severe intestinal condition caused by a bacteria called C. difficile. Additionally, long-term use of proton pump inhibitors like Zegerid may rarely cause vitamin B12 deficiency. If you notice symptoms of vitamin B12 deficiency, such as weakness, sore tongue, or numbness/tingling of the hands/feet, contact your doctor immediately. While a severe allergic reaction to Zegerid is rare, seek medical help if you experience symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, trouble breathing, or signs of kidney problems. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you have any concerns about side effects, always consult your healthcare professional. Before taking Zegerid, make sure to inform your doctor or pharmacist if you have any allergies to omeprazole, sodium bicarbonate, or similar drugs. Also, let them know about your medical history, especially if you have kidney problems, liver disease, low blood calcium or potassium levels, or if you are on a low-salt diet. If you experience symptoms like heartburn with lightheadedness, sweating, dizziness, or chest pain, seek medical help immediately. Also, if you have trouble swallowing food, bloody vomit, black stools, or frequent chest pain, it's important to get medical help right away. If you are considering self-treating with Zegerid, make sure to consult with a doctor if you have diabetes or any other condition that requires you to limit sugar in your diet. For older adults, it's important to be aware of the potential side effects, such as bone loss and fractures, and C. difficile infection. And for children, they may be more sensitive to certain side effects like fever, cough, and infections of the nose, throat, or airways. If you are pregnant or breastfeeding, discuss the risks and benefits of using Zegerid with your doctor before taking the medication. When taking Zegerid, it's important to be aware of potential drug interactions. This can affect how well your medications work and may increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Zegerid include clopidogrel, mavacamten, memantine, methotrexate, rifampin, and St. John's wort. Additionally, some products require stomach acid for proper absorption, and Zegerid, which decreases stomach acid, may change how well these products work. It's important to discuss this with your healthcare provider. It's also important to note that omeprazole, which is in Zegerid, is very similar to esomeprazole, so it's important not to use any medications containing esomeprazole while using Zegerid. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are taking Zegerid. If you or someone you know has taken too much Zegerid and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. Symptoms of overdose may include confusion, excessive sweating, blurred vision, rapid heartbeat, and seizures. It's crucial to act quickly and get the necessary medical attention in case of an overdose. If your doctor has prescribed Zegerid for you, it's important not to share it with others. If you're instructed to use this medication regularly for a long time, you may need to have lab and/or medical tests done, such as a magnesium blood test and checking your vitamin B12 levels. Make sure to keep all your medical and lab appointments and consult your doctor for more details. It's important to follow your doctor's instructions carefully to get the most benefit from Zegerid. The usual dosage is once a day, usually before a meal. Be sure to take it at the same time each day. If you forget to take a dose of Zegerid, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Remember to take Zegerid every day as prescribed by your doctor. When it comes to Zegerid, it's important to store the capsules and powder packets at room temperature, keeping them away from light and moisture. Make sure not to open the packets until you're ready to use them, and avoid storing them in the bathroom. The suspension should be kept in the refrigerator, also away from light, and be sure not to freeze it. If you have any unused suspension after 30 days, it's best to discard it. It's important to keep all medications out of the reach of children and pets. When it's time to get rid of any expired or unused Zegerid, it's important to do so properly. Instead of flushing it down the toilet or pouring it into a drain, it's best to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.